Hello guys, this is Dr. Cosby. Today we are going to be learning how to tape an ankle sprain. This particular tape job will be, you'll use it most often for lateral ankle sprains. What do I mean by that? That's an ankle sprain where the ankle has gone into an inversion moment. And so what you're really trying to do is you're trying to prevent the patient from going into that motion and stretching those lateral ligaments. So in order to tape for a lateral ankle sprain, you'll need a few different products. The first product that you'll need is a tape adherent, or what we know in the athletic training community as tough skin. So this is the first thing that we're going to do when we tape any patient. So we're going to take the lid off and we're going to spray that patient. And then we're going to allow that tough skin about 20 to 30 seconds to dry. Once the patient's skin is sticky to touch, then what we're going to do is put that patient up into a dorsiflexed position. Can you all see that there? The next thing that we're going to do is, I call these lifesavers. We're going to put these lifesavers in two specific anatomical positions on the foot. The first heel and lace pad is going to go just over the talocrural joint, or the top of the talus. And then this second heel pad is going to go on the back to cover the Achilles tendon. And some of you might ask, well, why are we putting these heel and lace pads on the ankle in these positions? It's because these are the bending points, or the points in which the patient is probably going to get pinched the most, the point at which the tape might cause blisters. So please do not forget this when you're taping. Once you have your heel and lace pads on, once your patient is sprayed down, the next step would be to apply pre-wrap. And what you'll know and what you'll remember from the lecture is that pre-wrap is a protectant for your patient. So we are going to start proximally, just below the distal portion of the gastrocnemius muscle group. And remember, you're going to half lap your pre-wrap, okay? So as I'm wrapping, what I'm making sure of is that all of my patient's skin is covered. So there's no real method to the madness, but just to make sure your patient's skin is covered. Once I've covered the patient's skin, I'm gonna lay that pre-wrap down and smooth it, and I'm gonna start with my tape. In order to do a lateral ankle sprain tape job, we are going to start with 2 anchor strips proximally. So anchor strip 1, strip 2, and you'll notice that I am half lapping my tape, so that looks really nice. There'll be times where you're taping your ankle where your patient's foot might slip into a plantar flexion moment, so just give your patient a gentle reminder to move up into a dorsiflex position. Your next anchor strip is going to go distally just above that base of the fifth. So we're going to do one on the dorsum of the foot, and then we're going to kneel down and do one on the plantar surface of the foot. So now that we have our proximal and our distal anchor points, the next thing that we are going to do is what's called a stirrup. This first stirrup will start on the most posterior portion of the medial malleolus, and you'll pull that stirrup over onto the lateral side posterior to that lateral malleolus. So that's anchor strip number 1. You will then follow that anchor strip with a C-clamp. The first C-clamp will start on the lateral side and be just below or just distal to that lateral malleolus and be pulled medially over to the other side of the foot. We will continue this process with a second stirrup, which sits in the center of the medial malleolus, comes over to the lateral side in the center of the lateral malleolus. We will then half lap with a second C-clamp. And then the same applies for the third stirrup, which is most lateral on the medial side. We will finish with a third and final C-clamp. And if you finish your tape job and you notice that you have what are called windows, you just half lap one more time to cover those windows so no pre-wrap is showing. So this is the first part and most important part to a lateral ankle sprain tape job. This is the part that's probably the most protective. So we want to make sure that, number one, it looks nice, right? Every athlete cares about how an ankle tape job looks. But secondarily, you want to make sure that you are alternating between your stirrups and your C-clamps. Now we get into the fun part of taping ankles, and that's going to be with what is called a figure 8 heel lock. Now your textbook will show you how to break these up, but I would like to show you probably the most clinically practical way to start a figure 8 in heel lock. So I'm going to begin my figure 8 heel lock series just proximal to that lateral malleolus. What I'm going to do is come down across the talocrural joint, around the plantar surface of the heel, and then I'm going to lock. Can you guys see that? I'm going to lock that lateral malleolus, come up. I'm going to go around one time to get a good angle, and then I'm going to come back down across that talocrural joint just above that base of the fifth, and then I'm going to lock that medial heel. Once you've done that maneuver, you're going to tear the tape, smooth it down, and then last but not least, we are going to close off with 2 more anchor strips proximally. Please note, this is patient preference. Sometimes I close off distally, sometimes I don't. I typically ask my patient what their preference is. If their preference is to have that final distal anchor strip, then I will do what I did at the beginning of my tape job. I hope this is helpful. Thank you very much.